Hola, buenos dias. My name is Dr. Brandi Burton. I am a veterinarian with Suidae Health and Production, which is a 9 veterinarian swine exclusive vet practice based out of north central Iowa in Algona. We also have other offices in Algona as well as Minnesota. And so we are a veterinary practice that provides herd health consulting as well as production management for independent producers across the U.S., mainly Iowa, Minnesota, Nebraska, South Dakota, North Dakota, a lot of those hog den states. So 3 years ago, Prevacent was launched in the US, and Suidae was one of the first adopters of this vaccine. We continue to use this extensively in our clients as well as our managed systems. And we've also done several different research trials in our research barns looking at different aspects of Prevacent. And so a few things I'm going to touch on today are just what we've noticed are differences between Prevacent versus some of the competitor MLV vaccines for PRRS on the market. And so one of the first things that was really pretty noticeable was the smoothness of the vaccine. And so historically, our clients really don't like to use MLV PRRS because it can cause off-feed aborts, almost mini PRRS breaks. And one thing we've noticed with Prevacent, it's very smooth. You don't see those aborts. You don't see those off-feed events. And in the sows, it's very smooth. But we also see these same effects in grow-finish pigs. So nursery pigs that are vaccinated, we don't see them go off feed. They're not hit very hard. So there's a lot of different production benefits to not, seeing those losses and pigs continuing to do well after vaccine. The other thing that we noticed, which has been really proven in some of the research projects that we've done, is the quick immune response that Prevacent elicits. And the way we've measured this is by looking at ELISAs or antibody production. And it has been very consistent that you can see an immune response in a pig that has been vaccinated with Prevacent in about 2 weeks. And that's about double versus some of the other competitors that can take 4 weeks and sometimes even 5 weeks. And the reason that's important is because, like I said, we work in some very hog dense areas and states. And so for us, it's very important for these pigs to be protected as soon as possible when they have a lot of lateral pressure for PRRS. And so that quick immune response is very important. Now we have to acknowledge ELISAs and antibody production does not necessarily mean that it's better protection, but at least it's one thing to give us some confidence in that these pigs are going to be protected as quickly as possible, or at least giving them the chance to by measuring their antibody response. And with that, when we're talking about diagnostics, one thing that I've noticed quite consistently as well is that the CT values are very high, so greater than 30 when it is vaccine strain. And so what that means is that there's not a lot of virus when we're doing these diagnostics, such as processing fluids, oral fluids, and serum. And from a practitioner perspective, especially one that works with independent producers, I have a lot of clients that want to spend as little amount of money on diagnostics as possible. So it doesn't always make sense to sequence all these vaccines or all these PRRS strains that we see through diagnostics. And so when I can tell that there's a high CT or not a lot of virus and the pigs have been vaccinated with Prevacent, I can almost always be confident in the fact that that is vaccine strain likely and not have to go through the cost of always sequencing to figure out if it's vaccine or if it's wild type. In other competitor PRRS vaccines, those generally do have lower CT values, a lot more similar with what can be wild type. And so in those cases, when you're using the competitor MLV or the other MLV options on the market, you almost have to sequence to understand whether or not it's a wild type and or a vaccine strain. And this can be important just from a health perspective, but in our world, biosecurity is very big, right? And so wanting to know and have confidence that that is likely vaccine strain versus wild type is really important for us. And then kind of along those same lines, when we think about, there's not a lot of virus when we're talking about Prevacent in that vaccine, we also see a lot less shedding. And we've also seen this in our research projects that we've done. So when we have pigs in the same pen that have been vaccinated with Prevacent as pigs that did not receive any PRRS vaccine, there's not a lot of shedding between those two animals. So the vaccinated pigs are not necessarily shedding to the unvaccinated pigs. And that's important for us on sow farms specifically. We don't want a lot of virus moving on those farms. And then when you think in the grow finish world, there's a lot of pigs with this vaccine. And so You imagine a lot of virus just in general because of the amount of pigs on these sites. And so when we reduce the amount of shedding, we're not going to be worried as much about laterally infecting our neighbors or having that virus spread among sites in these hog dense areas. So also kind of protecting our neighbors at the same time. And I think a lot of this also kind of plays into the reason, or one of the benefits of not shedding, is that we're not moving virus. So that has caused there to be a lot less mutation within the vaccine strain. So some of the other PRRS vaccines we've seen them mutate quite a bit. And when that happens, so if you get a mutation more than 1% of the original strain of vaccine, it can cause kind of like a mini break. It can actually act like a wild type exposure just because it is so different from that original vaccine strain. So with Prevacent, we have not seen that mutation. I've not seen anything more than 1%. And I think, again, that goes back to there's not a lot of virus and there's not a lot of shedding. So we haven't seen that mutation. It is still a new vaccine, so I can't say that that's not always going to be the case. But to date, we still don't see those mutations, which is, again, very important when you think of a virus such as PRRS that is just likely to mutate on its own. And then going along with that sequencing piece of it, when we look at sequences, when we do have these wild type viruses that we get sequences on the OR5, and we're comparing them on dendrograms and phylogenetic trees, most of the time, I'd say a large percentage of the time, the homology between the wild type strains and Prevacent is much more similar compared to other commercial vaccines. So it's, thinking and choosing a vaccine that's likely going to be similar or most similar to strains that you're exposed to. Prevacent has always come on top as far as being most similar to the strains that we're seeing out in the field. So therefore, as far as a commercial vaccine goes, providing the most protection, we're hoping to provide the most protection and reduce those clinical signs in those pigs compared to some of the other vaccines out on the market. And so kind of taking all those things, which I think are very, interconnected to one another, but is very important for us as me as a practitioner in choosing which vaccines I'm going to recommend to my clients. At the end of the day, PRRS is very complicated and there's no one solution. We're still trying to figure that out, right? But at least this can be one tool that can kind of help bridge that gap in controlling this disease. And so I guess some of the takeaways from this today I'd like you to know is that we feel that Prevacent can provide some pretty good protection, and then we see less production losses, and then therefore our clients can increase their profitability as best as possible when you're talking about PRRS control and trying to tackle all of this. So that's just kind of my perspectives of a practitioner. Hope you have a great rest of your conference. Adios.